Hi, I'm Erica Brown.
Melinda Walterman.
Troy Yang.
We are HNF 472 students, and our group conducted our evidence analysis project on acupuncture and whether or not it is beneficial for hypertension. So what is acupuncture? Acupuncture began in China over 2,000 years ago. It is an alternative medical treatment that uses the insertion of dry needles into the skin at specific points. These are referred to as acupuncture points. There are a number of different kinds of acupuncture which may use electricity, heat, or pressure to stimulate acupuncture points. But our studies will be focusing on traditional acupuncture. Some possible benefits of acupuncture for health conditions include hypertension, pain relief, chemotherapy-induced nausea and vomiting, and addictions. While it is not proven, it is believed that acupuncture works to reduce blood pressure by stimulating the nervous system to release chemicals such as endorphin and serotonin. It is estimated that 10% of Americans have tried acupuncture, and 2/3 of Americans would consider using it. And the typical cost of acupuncture is about $50 to $100 per session.
The first study we investigated was a randomized trial of acupuncture to lower blood pressure. It was a single-blind placebo-controlled study, and we gave the study a grade of A- since it was a randomized placebo-controlled study, but it was only single-blind. 160 participants with uncomplicated arterial hypertension were involved in the study, with 78% of the participants receiving antihypertensive medication. Participants included 78 men, ages 58 plus or minus 8 years. They were involved in 6 weeks of treatment with 2 follow-up visits at 3 months and 6 months. The subjects were placed into 2 treatment groups: traditional Chinese medicine acupuncture with trained acupuncture physicians, as well as sham acupuncture. In the sham acupuncture group, needles were inserted into points on the body that did not have any relevance to blood pressure, according to the traditional Chinese medicine. As for the results, 133 participants fully completed the study, and there was an overall improvement in hypertension seen within the participants. The average 24-hour period ambulatory blood pressure monitoring used a 95% confidence interval and showed a decrease of 6.4 with a standard deviation of 2.8 millimeters mercury in systolic blood pressure, and a decrease of 3.0 with a standard deviation of 1.5 millimeters mercury in diastolic blood pressure. The average blood pressure of TCM acupuncture group was 6.4 millimeters mercury in systolic and 3.7 millimeters mercury diastolic, lower than the sham acupuncture group. Therefore, the difference between TCM and sham acupuncture groups was statistically significant, with a p-value of less than 0.001. The average daytime systolic and diastolic blood pressure reduced significantly by 6.5 millimeters mercury in the TCM acupuncture group, yet there were no statistically significant difference seen in the nighttime diastolic blood pressure and exercise blood pressure, since they were already low. The acupuncture's effect did not outlast duration of treatment either. The overall implication of this study is that acupuncture appears to be an effective and safe therapy for the treatment of hypertension in patients in the age range of 45 to 75 years who are otherwise healthy.
Our second study was on the Stop Hypertension with Acupuncture Research Program, or SHARP. We gave this study a grade of A because it uses a prospective, double-blind, randomized, sham-controlled parallel group. The clinical trial was over a 6-week period and involved 192 participants. All participants had untreated blood pressure within the range of 140/90 to 179/109 millimeters mercury. They were weaned off of any antihypertensive medication for the duration of the study. There were 140 males and 78 females with an average age of 55.9 and a standard deviation of 10.6 years. They were split into 3 treatment groups, which included traditional Chinese medicine acupuncture, standardized acupuncture at pre-selected points, and invasive sham acupuncture. The results of this study showed improvement in hypertension with a 95% confidence interval. The average systolic blood pressure decreased by 3.7 with a standard deviation of 0.2 millimeters mercury and a p-value of 0.48. The average diastolic blood pressure decreased by 3.8 with a standard deviation of 1 millimeter mercury and a p-value of 0.35. Because of the limited decrease in blood pressure, this study is inconclusive. There was no significant difference between the treatment groups, and while some participants did experience substantial improvements, the results could not be generalized. The author's interpretation of this study is that the changes in blood pressure could be due to other factors such as lifestyle and diet changes or the placebo effect, since results were comparable to pharmaceutical placebo studies. Results show that the treatment may not have been adequately administered since the published results referenced report significant reductions in blood pressure.
Our third study was titled Acupuncture, a promising adjunctive therapy for essential hypertension. This study was an 8-week randomized double-blind placebo-controlled study, and the study included 41 subjects who were either pre-hypertensive or on medication for hypertension. Of the subjects who finished the study, the average age was 53 years with a standard deviation of 4 years, and the gender profile included 9 males and 21 females. We gave the study a grade of A- since it was a study of good design. However, there were only 41 subjects and only 30 of the subjects finished the study. The subjects were placed into 2 treatment groups, and these included a traditional Chinese medicine acupuncture group and a sham acupuncture group in which practitioners inserted needles at incorrect points in the body according to traditional Chinese medicine. Overall, 30 subjects completed the study. The results of the studies found that the sham acupuncture group showed no significant change in blood pressure. However, the traditional Chinese medicine acupuncture group showed a significant decrease in mean blood pressure compared with the sham acupuncture group. This was assessed at a 95% confidence interval, and the p-value was less than 0.01. The average reduction in blood pressure was from 136.8 over 83.7 to 122.1 over 76.8 milligrams mercury. The p-value was not significant due to the small sample size. The author's interpretation of this study was that the results were promising, but results could not be generalized due to the small sample size.
For the overall level of evidence, we gave them a grade 2, fair. This was because the results from the studies were of strong design, yet there was uncertainty attached to the conclusion due to doubts and generalizations, biases, and inadequacies within the sample sizes. The results were confirmed in separate studies and are consistent with minor exceptions.
Even though acupuncture is FDA regulated and acupuncture needles need to be sterile, non-toxic, and single-use by qualified practitioners only, there are some contraindications and side effects to be aware of. Some contraindications for acupuncture include bleeding disorders and blood thinning medications, pregnancy during the first trimester, cardiac pacemakers, and blood or skin infections. Relatively few complications are reported to the FDA. However, acupuncture that is not properly delivered by qualified practitioners can result in serious side effects such as punctured organs or infections. Acupuncture has not been proven to be beneficial in treating hypertension. Some studies show promising results, however, more studies need to be done on this subject. Therefore, we do not recommend acupuncture for the treatment of hypertension.